This is our presentation on depression and tinnitus. What is depression? Depression or major depressive disorder is a common and serious medical disorder that negatively affects how you feel, think, act, and perceive the world, according to the American Psychiatric Association. Depression is one of the leading causes of disability worldwide and significantly impacts physical health, cognition, and quality of life. Approximately 8.35% of U.S. adults experience a major depressive episode each year. The core symptoms include persistent depressed mood, loss of interest, fatigue, sleep disturbances, difficulty concentrating, feelings of worthlessness, and changes in appetite. So, how does depression affect the body? It is often thought of as simply feeling sad, but it's actually a complex medical condition that affects multiple systems throughout the body, starting with the brain, like changes in serotonin, dopamine, norepinephrine, and limbic system dysfunction, which is involved with emotion, memory, and stress responses, as well as sleep disruption and fatigue, pain sensitivity, immune and stress changes. Going into function, it is thought to cause reduced concentration and social withdrawal, decrease overall quality of life, and common comorbidities include anxiety, sleep disorders, and chronic pain. As far as the timeline and severity, it may occur as a single episode or reoccur throughout life, but to be diagnosed, you have to have symptoms that persist for more than 2 weeks and may become chronic. The brain image on the right provides a visual evidence that depression is associated with measurable changes in brain activity and metabolism, reinforcing that it is a biological condition rather than simply an emotional state. What is the connection? Rochester and colleagues in 2010 proposed what's known as a limbic auditory interaction model. Rather than focusing on how common depression is within people with tinnitus, the study explored what is happening in the brain that causes tinnitus to become persistent. They found that the brain normally filters out unimportant sounds, but this system becomes less effective in chronic tinnitus. And the key findings were that emotional brain regions influence how distressing tinnitus feels. Reduced filtering allows tinnitus to remain in conscious awareness, and habituation becomes more difficult over time. This is clinically significant because it explains why tinnitus affects people differently, as well as why emotional distress can increase tinnitus severity, and it supports treating both the emotional and auditory aspects of tinnitus. And if you look at the figure on the right, the top diagram represents compensated tinnitus, where the brain is still able to filter the tinnitus signal, allowing for individuals to gradually habituate. But the bottom diagram represents chronic tinnitus, where this filtering process is disrupted, causing the tinnitus signal to remain in conscious awareness and becoming more distressing. Although the study did not specifically examine depression, it does provide a neurological explanation for why tinnitus and depression are so often linked. Because depression involves many of the same emotional and attention networks, it may increase how intrusive and distressing tinnitus is perceived. So, this highlights the importance of addressing the emotional and auditory components when managing patients with tinnitus. As far as the risk factors, I'll start with genetics. It's a multifactorial disorder and there's no single cause, but as families that have a history of depression are thought to be more at risk, as well as more susceptible to mood disorders. It can occur across the lifespan in adolescence and young adulthood, but more frequently with adults who are experiencing hearing loss or major life transitions like chronic stress, as well as trauma, social isolation, and limited social support. Other medical conditions like chronic pain, sleep disorders, and chronic illnesses. And lastly, lifestyle and occupational factors like noise exposure, poor sleep habits, substance misuse, and high stress occupations. Understanding these risk factors is important because depression often results from the interaction of multiple influences rather than a single event. And recognizing these factors also allows healthcare providers to identify individuals who may be benefiting from earlier screening, intervention, and support.
Okay, for this next slide, we're looking at research and other considerations. First, we looked at a systematic review to see how commonly depression develops in patients with tinnitus. The intent of this study was to quantify the comorbidities of the depression with tinnitus. There was close to 10,000 participants from 15 different countries. Of that, nearly 1/3, or 33% of patients with tinnitus suffered from depression. This demonstrates that depression is one of the most common coexisting diseases with tinnitus, emphasizing the importance of mental health in tinnitus care. The second study focused on a slightly different question. It asks whether the severity of tinnitus is related to the severity of depressive symptoms. With over 1,900 articles reviewed, and every study indicated that those who were more affected by tinnitus tended to have higher symptoms of depression. Of that, there is further research needed regarding whether tinnitus directly causes depression. However, the authors emphasize that this is a correlation, not proof that tinnitus directly causes depression. When comparing the two studies, there were several important similarities. Both were systematic reviews, meaning that they analyzed findings from multiple studies rather than relying on a single patient group. Both concluded that depression is a very common comorbidity in people with tinnitus. The biggest difference is that the first study emphasized on prevalence, showing that about 33% of patients have depression, while the second focused on severity, demonstrating that greater tinnitus distress is associated with more severe depressive symptoms. Together, these studies reinforce the importance of evaluating both tinnitus symptoms and a patient's mental health status. Why this matters. These findings are significant because they immediately impact our clinical practice. Participants with tinnitus, 33% also experience depression. Knowing this information helps effective management approach for this group. Validated screening tools such as the Beck Depression Inventory for Depression and the TFI or TRQ can aid in identifying patients who may require more assistance. Employing these screeners as a counseling tool will help manage tinnitus. Recognizing these concerns early allow us to make appropriate referrals to psychologists or other mental health providers, potentially improving long-term patient outcomes. Consequences. Finally, these studies highlight several important consequences of untreated tinnitus and depression. Psychologically, patients may experience reduced quality of life, depression, anxiety, and difficulty concentrating. Physically, many patients report fatigue, poor concentration, and increased awareness of their tinnitus. Socially, they may withdraw from family and friends. Because of these impacts, the recommended approach is to screen for depression as part of the tinnitus evaluation. Make referrals when appropriate and educational counseling for the patient that addresses both auditory symptoms and the patient's overall well-being.
So next, we are going to go into treatment and evidence-based research. So the first option we have is utilizing a psychologist. They're going to use cognitive behavioral therapy from a licensed mental health psychologist that can provide relief from the tinnitus symptoms and also teach coping mechanisms to aid and reduce depression. What is cognitive behavioral therapy? This therapy utilizes your thoughts, feelings, and behavior to show how they are all connected. This allows patients to regulate their emotions and respond to challenging situations in a healthy way. The second treatment option is sound therapy and utilizing hearing aids. Having comforting sounds can help mask or reduce the tinnitus. This promotes habituation in the brain, which can improve relaxation. Hearing aids also allow people with hearing loss to have more access to sound, which thus reduces isolation. Utilizing Resound Tinnitus Relief app or having programmed hearing aids with maskers and amplification when necessary are some common ways that we use sound therapy and hearing aids. The third way is using coping and support groups. Bringing individuals together who are experiencing similar symptoms can create a safe environment for them to understand tinnitus and depression. It can reduce fear, anxiety, and encourage effective coping strategies. At our clinic here, we have a tinnitus counseling series. This is where our patients get to learn how to cope with their tinnitus in more specialized areas such as sleep and daily living. Next, we have an evidence-based research based on this cognitive behavioral therapy to show how important it really is. The first purpose of this research was that the researchers wanted to determine whether cognitive behavioral therapy could reduce tinnitus distress, depression, psychological distress, and the negative impact of tinnitus on daily life. How they did this was by using 65 adults with tinnitus, and they were assigned to either an 8-week group therapy program or a waitlist control group. This therapy program included cognitive restructuring, relaxation training, and activity planning. The total results from this research found that the group that completed the therapy program had significant improvements compared to the control group. Tinnitus distress and depression were decreased, and participants experienced an improved quality of life. Out of the 65 adults, 41 total completed the treatment. However, there are some limitations to this research. Tinnitus loudness had little or no change. So this shows that while cognitive behavioral therapy does not eliminate the tinnitus, it changes the patient's emotional response. As depression decreases, the participants reported that their tinnitus became less bothersome and less interfered with their daily life. So next we want to talk about some key takeaways from what we have discussed previously. The first is the connection. While depression and tinnitus are strongly linked, neither directly cause each other. Tinnitus can worsen depression symptoms, and depression can increase awareness and distress from tinnitus. The second is that research and the statistics. More severe tinnitus distress correlates with higher depression levels. Recognizing that nearly 1/3 of our patients that we see struggle with depression is crucial for effective audiologist counseling. Our third is screening and the importance of cognitive behavioral therapy. Audiologists should screen for depression utilizing the Beck Depression Inventory and refer to psychologists when necessary. Cognitive behavioral therapy significantly reduces both tinnitus and depression. If you look on the right, the image that is shown is called the iceberg model of bothersome tinnitus. It is used by audiologists in Canada to show the correlation between tinnitus and the mental health struggles like depression. It shows how they are linked together, and while the auditory component being the tinnitus you can see on the top of the iceberg, many patients are suffering with depression that affects their everyday life, which you can see that is below the water. And these are our references and works cited. Thank you.